Thank you, Allison, and thank you to CIHR for funding this cafe. We're all talking about something a little different, but all of them relate to the importance of considering gender when we look at the relationship between work and health. And while some of my colleagues are going to talk about reducing exposure, for example, to accidents and injuries, I want to take a different tack and talk a little bit about what we call promoting health in the workplace, and specifically some of the challenges that have emerged with respect to employees with significant caregiving responsibilities and the challenges that they are experiencing managing what are demanding roles of work and caregiving. There are quite a few theoretical frameworks to draw on when we look at thinking about the fit between work and family or other roles that individuals may have that go back to the 1930s when Kurt Levine first talked about person-environment fit, something we've probably all heard of. But even in today's research, there's quite a bit of interest in talking about the perceived fit between work and work demands and resources and the demands and resources available to us in other roles, such as caregivers. When we have work-family conflict, when we're experiencing pressure, overload, time crunch, incapacity to really tweak the roles and role demands and expectations or to gain the resources we need to function effectively, is when people start to experience both detriments in their work performance and work engagement, but also potentially even physical and mental health consequences. So the importance of this for employers, I think, is pretty obvious. We know, for example, that absenteeism and missed days of work can be costly for employers, but so can situations such as employees who are stressed but present at work and not doing very well in that situation, or who are feeling distracted or tired and exhausted from caregiving demands because they're having difficulty locating the resources they need in the community. And so the lack of access or the lack of availability of the supports that are required to caregive effectively can be impacting on their work performance. What I've found in my research is that there has traditionally been a higher rate of indicators of time crunch and work stress among women compared to men. But when you break it down further, it's more the gender piece. It's more the caregiving piece, in fact. So we know, for example, that mothers experience considerably more work-family conflict than women who are not, who don't have children. And similarly, those who are engaged in caregiving for an aging parent or a family member with a disability or a chronic illness, and who take on a major role in providing that care, whether they're men or women, are the ones who are more likely to experience a number of different consequences. Employment consequences, including absenteeism, having to reduce from full-time to part-time, perhaps loss of productivity, and potentially even loss of a job or having to take retirement early, which can have long-term economic consequences. Even the loss of benefits if you lose your job and you have relied on health benefits available through the employer. But there are also important studies, including Canadian General Social Survey from 2012, that indicate that women, and particularly those who are providing what we call intense levels of care, such as 20 or more hours of care per week to a family member, are particularly at risk of a series of adverse outcomes. So again, those who are providing more care tend to be women in terms of more hours, but they also tend to be more likely to be providing personal care, assistance with medical tasks, food preparation, the kinds of things that require in-person involvement on a regular basis. So not the yard work, not the taxes. It's the stuff that has to be done in person and can sometimes be difficult, physically difficult to do as well. When we look at those who are providing that level of care, it's not surprising that we see high levels of stress and that we're seeing high levels of potential health consequences, feeling tired, feeling exhausted, feeling overwhelmed, feeling that you don't have enough hours in the day, but also that you don't have the resources you need. For employers, what we are seeing is that more of them are starting to see more employees with caregiving responsibilities at work. In fact, our stats about population aging, longer life expectancy, all of those demographics that are out there that many of us are at least acquainted with, if not intimately engaged with, will tell you that we have an older population, we have more people who are engaged in caregiving than ever before, and those numbers are only going in one direction, which is up. So employers are starting to see this. They're starting to provide more flexibility and more support in the workplace, but they're a bit stymied about what is the role of others engaged in this. Employers who are seeing the need for information about caregiving resources, about home care, about how do you help your dad finally use that hearing aid that he paid money for. The challenges, especially of someone with dementia or someone who has mental health problems that you're trying to provide care for, these are beyond what most employers feel they can help with or should help with. And what we're learning from best practices around the world, including in the UK, where there is an organization called Employers for Carers, is that employers are trying to articulate that what they need is for government and community to step up to do their part as well. So they're willing to engage in providing more flexibility and more support, but they also need to have available the resources for employees to use and to be able to access, and government policies that can help as well. We're at an interesting point right now because we're becoming more and more aware of where the gaps are and where the opportunities are to really make a difference. And I would suggest to you that what I'm seeing in my research isn't that there's a lack of awareness. At one point that was true. But right now there's a lack of sense of what is best for me, the employer, to provide, and what do I need to have available in the community for my employees to be able to use. Some of that requires a kind of culture change. It requires more of a partnership approach, being more aware of, again, what the relative roles are. But it also means that we're starting to look at sustainability in a different way than we have before, in terms of the sustainability of a workforce that can function effectively in complex circumstances with the supports they need to do it. Thank you.